we are currently looking at numbers that are close to 4 times the number of Indigenous people infected by COVID-19 during the first wave. This is serious. In light of the alarming rise in COVID-19 cases in Alberta and Saskatchewan, hearing from Indigenous leadership in Alberta and Saskatchewan has been critical in understanding what support is required to make an immediate and meaningful difference for Indigenous peoples in Alberta and Saskatchewan. In Alberta, there are currently 318 active cases, and there's been a total of 859 cases of COVID-19 in First Nations communities. In Saskatchewan, there are currently 344 active cases for a total of 728 cases of COVID-19 in First Nations communities on reserve. Our data is limited, and so this only represents cases on reserve. True cases among First Nations individuals in both these provinces is much higher. And indeed, if the numbers that we are seeing in Manitoba, off reserve, in urban areas predominantly, particularly as regards the disproportionate number of hospitalization and members of First Nations in ICUs, this is alarming, as if they are the same in Alberta and Saskatchewan, the scale of Indigenous infections in those areas is indeed much higher. So when I say we have an imperfect picture of Indigenous infection across Canada, that's reality. And it's a reality that we struggle with because it's very hard to tailor those options in order to keep people safe. The federal government has a role to play with respect to Indigenous health off reserve. It's clear, but it places an effective challenge, and that effective challenge is made more so when we don't have proper numbers. So it's a process of working with the governments. It's a process of working with First Nations. We funded, for example, Janet Smiley to do some work on that, who's really on the front lines in Toronto, and a number of other organizations. But to say that we are relatively comfortable with the numbers, well, I think it would be, it wouldn't reflect my current state of mind, as you can tell.